Good evening to our listening audience. Good evening, Bahamas. And we want to say good evening to the world because, of course, we are heard far and wide. Want to welcome you to the final session of Share Your Story for this season. It's been a very long season and it's been an interesting season. The goal of this show is to enlighten, educate, and inform our audience, and in particular the Bahamian public, about different issues that affect us here in the Bahamas. A lot of health issues and even issues that we have to deal with on a day-to-day basis. My name is Dr. Ebby Shera Jackson, and I am the host for your show. It's been a pleasure having the show, bringing on different guests so they can share their different experiences, and more importantly, to have our listening audience view the show and listen to it on a consistent basis. I want to say thank you to all of you because it's you all who have made the show. This evening, we wanted to end the show with a very special, important topic. And this topic involves families, it involves parents, it involves children, it involves the healthcare team. And it's a topic that is not highlighted as much as a lot of other issues and illnesses that we face here in the Bahamas. The word autism, when you hear that word, to a lot of people, they see it as a negative word. You know, they don't like to hear it, but it's actually a reality and it affects a lot of households and persons here in our country. So this evening, I'm excited to have two very special guests who I will be bringing into the studio in a few minutes to talk about autism here in the Bahamas. You know, for many years, it was a topic that you hardly heard about. But yes, of course, we saw a lot of persons who may have seemed like they had challenges and whatever have you. And a lot of times, persons were not diagnosed and just existed in society, and we had our own names for them. But as society developed and diseases and conditions became more prevalent, and then with specialty, a lot of these conditions were able to be diagnosed, and so that persons could be managed and it would be healthy for persons, families, and even their children. So this evening, without further ado, I'm going to bring my two special guests into the studio, and I will have them introduce themselves, and we will continue the show. Welcome, ladies. Two lovely ladies in the show, in the studio this evening. How are you guys doing? How are you ladies doing?
We're good.
Pretty good.
It's Thursday, again, almost the end of the week. And, you know, we all look forward to the end of the week, don't we? But before we end this week and before we end this series, we wanted to just bring both of you in to have you talk about a very timely, interesting topic that needs to be discussed and shared, you know, in our country. And we need to be more open about it. So to my very special guest, welcome. And it's a pleasure to have both of you on. I will start with Lady Paula. Her name is Paula Maria Hospedales.
Yes, that's right.
Tell the audience, who is Paula?
So I am a mother of two sons. My second son has autism. He is 13. He is termed functionally nonverbal, so that means that he doesn't use speech to communicate. He was born here in the Bahamas. We moved here in 2007, and he was born in 2008. And very early on, we realized that he wasn't developing as quickly as my older child, who is 16.
Before you get into that, Paula, tell us who you are, please. Who's Paula?
My name is Paula Maria Hospedales. I am currently serving as the secretary for REACH. REACH is a non-governmental agency. It's an advocacy group that was founded by parents in 1999. And so I serve as the secretary of the board. I've been serving in this capacity since, I believe, 2018, 2017. And I joined REACH as a parent seeking information.
Now, are you originally from the Bahamas, Paula?
I am Trinidadian, if you didn't get the accent.
Okay,
Yeah, so
good.
I am from Trinidad. So we moved here.
How long
my
have you
husband,
been here? Right.
Since 2007, we've been here. So we moved here from Trinidad with my older son. I was pregnant, so Obasi was born the next year, right here in the Bahamas. Yeah, so Bahamas is our home. It's where
Where do
we've
you work,
settled.
or what do you do? Are you a
I
full-time
work.
mom, or what do you do?
I actually am employed with Kalina Insurance Limited. I have been employed with them since 2009. So I am in the IT and project management field. So I head two departments, two small departments, one for reinsurance and the other one for the life business analyst.
So you're a mom and you're dealing with a
I'm a
family and
mom
you're
and
dealing
I'm a
with a
full-time
child who has
employee.
autism.
Yes.
Okay. So this is a family
And a
issue.
teenager. It's,
Yeah.
it starts in the family, but it then very quickly, once you reach school age, it becomes more of a community issue. And even before you reach school age, because for me, what I've noticed is there's a lot of judgment when anything is different. And with a child on autism, and my child specifically, who make it obvious that he is not typical, there are a lot of people who judge. And so it becomes a wider issue of just educating people and just so that they could be aware. Because when a child is diagnosed with autism, it's kind of one of those hidden disorders because there's no physical tell. So if Obasi is sitting with the family at a restaurant and somebody to pass us by, they wouldn't notice
Okay.
that
Okay. We'll get
he's
into
different. Yeah.
we'll get into
Sure.
that as we continue.
Sure.
Now, our very special guest is Dr. Deshauna Saunders. Dr. Saunders, good evening.
Good evening.
Tell the audience, who is Dr. Saunders and what does Dr. Saunders do?
Okay, so good evening to our audience. My name is Dr. Deshaun Saunders. I am a pediatrician, for starters. I work at Precious Posterity Pediatrics, and where I practice general pediatrics. In addition, I am a pediatric consultant at the Princess Margaret Hospital. So I'm actually a director of a general pediatric team on our hospital campus. In addition, I have specialty training where I have done extra training, I would say, at Vanderbilt University in autism diagnostics. And so I have certification in testing and evaluating children for autism. And of recent, I have a new title added to my portfolio. In addition to me being a pediatric consultant at the hospital, I also direct our infectious pediatric disease clinic at the hospital and our neurodevelopmental clinic. But I also have a new title as Deputy Medical Chief of Staff for Princess Margaret Hospital.
Okay, you assumed
So,
that role just recently, right?
yes,
Because,
that's recently. Yes, since I last spoke with you.
Congratulations.
Yes,
Thank
congrats. Now, let me ask you something, Dr. Sanders. Are you the only trained autistic pediatric specialist here, or are there
No,
others?
so we have another, I have another pediatrician who also has training in testing and evaluation. We're not the only persons that can test and evaluate. You also have child psychologists who can also test and evaluate for the most part.
Okay, so it's a group and it's a body of persons that are trained to be able to detect. Now,
Correct.
I want you to tell our listening audience, what is autism? We've heard
All
that
right,
word.
so we hear that name a lot. So autism spectrum, umbrellaed into autism, is actually a neurodevelopmental disorder, and it affects children to adults depending when they're diagnosed. It's usually seen around mostly the age of 2 to 3, and it presents where children present with a delay in communication. So they either have decreased language. For kids who can't speak, they may have what we call echolalia. So they have repetitive language. In addition, it has social reciprocity. So what does that mean? These kids may
Yes.
have minimal eye contact. They may not be able to point. They may not be able to gesture. So nod yes or no, wave high or by. In addition, they are repetitive. So they have restrictive repetitive behavior. And so, starting with motor mannerisms, they may hand flap with excitement, they may toe walk, they may spin, they may jump. Other things in terms of their repetitiveness, they maybe have repetitive speech. And so, some parents think it's marvelous, but they can watch a TV program and they can sound like an actor, they can sound like a
Mm-hmm.
president, and they change their voice so they have intonation. And so, for instance, Peppa Pig speaks with an English accent, and they can speak English, speak like they're from England. You
British.
have, yes, you have some
Mm-hmm.
kids that change the accent. I've had kids who, because they've watched YouTube so much repetitively, they can speak Mandarin. And the parents doesn't understand the thing that they're saying. They don't understand the thing that they're saying, but they're verbal, but they're just repetitive in their speech. So they're unable to have a conversation. So they can talk, they can identify objects, but they cannot conversate. So that's the three main areas that it affects. It affects, as I said, repetition, their social, and their language.
Now, let me ask you something. If a child seems to want to just play by themselves, they don't seem to be socially interactive, but they're into their own world. Um, could you say that that's a possibility of autistic development or?
Definitely. So that is a red flag with kids who have difficulty in establishing relationships with children their age. And so things you'd want to ask the parent is to ask the school. You'd find that some kids, they play around other children, but they prefer to play to themselves. Or
Mm-hmm.
if they're playing, they are playing with the teacher.
Mm-hmm.
But they do not want to play with the other children. And so definitely that is a red flag. You know, COVID has changed a lot because a lot of schools were closed. A lot of our kids did not have that social exposure to other children. And so it's a thin line in terms of determining whether this is just social isolation or whether these kids actually have some social deficit going on. But that's definitely a red flag when you see these kids withdraw or not playing. I'll give you an example. A lot of parents pick it up at birthday parties because their child is invited to a birthday party. They go to where the other kids are, and everybody's running up and down playing, and their kid just doesn't want
Yeah.
to interact. And for a lot of our parents that kind of realized that something was wrong, that was their first sign, or even their friends
Mm-hmm.
noticed it. They're like, why is your child not playing with the other kids? And so that in itself starts the questions that, why does my child not want to play? Why does my child not want to interact?
Okay. Now, Paula,
Yes, ma'am.
you have a son who is autistic.
Yes.
How did you find out?
To be honest, I kind of guessed. We did have a formal diagnosis when he was 2.5, but I had signals that he wasn't developing the same. And
What
I, of
kind
course,
of signals?
he didn't, we thought that he was ignoring us. We thought that maybe he had a hearing deficit, which in fact he did. But also, we noticed that he wouldn't be interested in what you were doing. If you pointed at something, he wouldn't even look in that direction. If there's a loud noise or everybody exclaims, he was like in his own world, truly in his own world. And this is at like 10 months, where you find that children are interested in playing with toys. Like if you give them a phone, they put it to their ear because they're watching other adults, how they use a phone. He wouldn't do any of those things. And so for me, I realized early, but I have to say, Abby, just to be completely open, I am the child of a speech therapist who worked with children on the spectrum. So I have been exposed to children on the spectrum, on the autism spectrum, from the time I was a teenager. So just being able to see the same behaviors in your own child, for me, it wasn't like, what could this be? I was like, oh my, I think I know what this
How,
is
how did
looking
you
like.
how did you and your husband handle that? The fact that you
We were
recognize
not
that.
on the same page at the start. And, for a lot of Caribbean families, there is a lot of, he will talk when he's ready. And a lot of, well, my husband spoke late apparently. And, so people make a lot of excuses and and I do not think necessarily that there is a denial factor, but I also think that they don't want you to feel badly. Like, they don't want you to believe that there's something not quite right with your child. And so we did have some struggles. And of course, because we were new to the Bahamas at that time, and so we were far away from our friends and family, it was a little isolating at that time. So you're trying to reach out to family who are not seeing this child every day. They're not seeing the interaction every day. So for them, it's like, he's fine, But for me, I think I took it on as something I need to figure out what's happening to him. And so I ran it down like a crazy lady at points. I mean, I'm still a bit of, just I have learned so much from having to deal with Obasi and advocating for your own child, that even with my typical child, I'm going to be on top of the ball at all times, So for us, it was a struggle. I think his first 4 years of life were just a big learning experience and just trying to figure out where to find the tools. What school is he going to go to? Where do I find speech therapy, occupational therapy? What therapies does this child need over another child? And that's where I found Reach.
Okay.
Because,
Dr. Sanders, when we hear about autism, we hear it's on a scale. Could you explain to our listening audience what is the scale and what is involved with this scale? It's not the scale that you stand on to get your weight.
No, it's not.
It's not that one. Okay.
So when we look at autism, they describe it as a scale, but actually the DSM-5 has actually coined it all into one. And so they no longer use the scales. But when you look at a kid with autism, you have what we call mild, moderate, severe. Okay, so when we say mild, that they would call that Asperger's. And so with Asperger's, these are kids that are high functioning. And so what that means, they can talk, they can interact, they may have little social twerks, or so they go to school, they don't play well with other children, or they're isolated, they're just into computers, jigsaw puzzles, and they're able to go through the school system and not even knowingly that they are autistic, because they're brilliant, they're bright, they exceed at mathematics, they exceed at computers and engineering, and so that's what we call a mild form. So those cases are sometimes even missed. Moderate, we have kids that are delayed, so they may have speech, but it is they're not fully talking in sentences. They may have the behavioral issues, the tantrums, but they don't have all of the features of autism, and every child is different. So there's no one shoe that you could use to fit a child. Every child has a different presentation. And so with moderate kids, they can function with intensive therapy. And then you have severe. So with the severe kids, they are what we would call non-functional. And so meaning that they may have a delay in potty training, they may have a delay in feeding themselves. So self-help skills are concerned. And so as these ones get older, the severe cases, they may not be functional, meaning where they may not have a job, or they may not be able to get into a relationship. They may need full support from their family for the rest of their life. And so when we look at, that's why they call it a spectrum, we have different variations. So it's mild, moderate, severe.
Now, another question. Here in the Bahamas, what are you seeing as a doctor when patients come in?
All right. So I guess because of my area and because I'm a pediatrician, I see a cross-reference of kids, but most of my kids are picked up between the ages of 2.5 to 5. I do have some late patients that present at 7 and above. And those are the ones that, the parents didn't even have a concern. Even some of my younger kids' parents don't have a concern until either their pediatrician says to them, your kid's not talking. We need to check the hearing. Maybe something else is going on. But I'm seeing an increasing number. And I think with COVID has allowed parents to be home with their kids. And so they're now observing their kids for themselves. And they're realizing that, hey, my kid's not talking, or, oh, my kid has tantrums, or my kid smells his food, my kid smells his toys. my kid is doing things that not what a normal toddler wouldn't do. And so with those concerns, I've had an increasing number of parents. Every day I get calls with parents who have concerns about their kids. And so I reach out to everybody. So I do a lot of phone consultations. And so where I ask the parents what their concerns are, I ask in terms of if there's any repetitiveness, if there's any, what's going on with the language, what's going on with the behaviors, the tantrums, what's going on with their senses, because a lot of our kids have sensory concerns. And so all of the senses, I describe it are hyper. So for instance, they may be in the car and, an ambulance drive past and they hold their ears, or simple things like using a vacuum cleaner, a blow dryer, that is a stress for a child, and so when I start to find out those things from parents, and I realize that, there is a concern, and we're seeing increasing numbers. We are, I test every week, and I have like a 3-month waiting list for testing and evaluation because our numbers are high. We do not have exact numbers to say how many kids in the Bahamas, but the US statistics indicate that it's 1 in 59. And so I would extrapolate that to the Bahamas. We have 5,000 live births per year. And if we're looking at 1 in 59, we're looking at 100 kids a year that are likely born with autism and are being picked up at, who knows, later down or even being missed. So the numbers are high.
Now, is it more prevalent in males or females? What are you saying?
Right. So it is more
Males.
prevalent in males for sure. For it's one. So the prevalence is 1 in 5 for boys, and so for every 5 boys, you have 1 girl. But I would say this, interestingly, for that 1 girl, girls are usually, for whatever reason, more severe in terms of their symptomatology than boys. Yeah. So they're more severe.
Why do you think so?
So studies have not really coined to say why, because we really don't know what causes it. But for the girls that we see, they are actually moderate to severe. For a lot of the boys, I see every variation from mild to severe. But for the girls, nobody really knows what's the reasoning behind it, but they are more severe. So they have more symptomatology.
Right.
Paula, now,
Yes, ma'am.
what did you have to do to ensure that Obasi survive and make it? Tell
Well,
us,
we
as
we
a
enrolled
parent.
him in this as a parent, and just as from my own reading and learning, because you become an expert on your child while you're going through this process, and so I really wanted him to learn social cues, and so one of the things that we did, we enrolled him into preschool like every other child. Like we enrolled our older son, just letting them know that it wasn't about him learning his colors necessarily or him being able to figure out his numbers.
Take some
But for
BJCs
him,
or whatever.
yeah, it was about him understanding how to wait, how to share, how to line up. When everybody's going to the bathroom, let's go to the bathroom too. And so it's a lot of social living skills that he had. So he went to typical preschool, but it wasn't a situation that he was promoted to K4 and it was a movement that made sense socially for him. And then after preschool, we made the decision to put him in a special needs school because Basi is straddling the line. I think, Dr. Saunders, I know you've met him a couple of times, but he straddles the line between moderate and severe, just on different parts of the spectrum. So socially, Obasi, he's a Trini, so he's a limer. He wants to be where the people are. He's sensory seeking though. And so he wants the interaction of people, but he's not speaking. So there is that disconnect. And so those children tend to be hard to test because I can see that cognitively a lot of things are working, but you can't figure out, well, what are you getting from what you're not getting? It becomes a little bit challenging. So as Dr. Saunders said, we are focusing more on his life skills. And now as he's getting older, because like I said, he's 13, he's a preteen, we're focusing on just living skills. So for us, one of the things we added to his individualized educational plan this year was the ability to not to write, but to be able to sign his name. Just because that is going to be a skill that he is going to require in the long run, and we need to start because he was never interested in coloring. He's never interested in holding a pencil. It was not an interest for him. So we're working. And as Dr. Saunders said, some things are delayed. And with Obasi, some things were severely delayed.
Now,
So we're talking about potty training did not occur in full until he was 11. So, and this is like, I think it got to the point where it may have been, he may have had assistance in the home because he had an aide to go to school. He still has an aide, and he has us, and we have a housekeeper. So, he was assisted in just saying, okay, well, you're accident, let's just clean, let's just move on. And so we had to change our own mindset. And I think on that one, we held him back a bit. But when he got it, thank God.
another question.
Thank goodness. Yes.
How was his interaction with other children, and how did you as a parent handle that?
Kids.
He loves kids, but how did the kids respond to him?
Some kids respond well. Some kids have questions, and I prefer to have a child who has a question and needs to figure out, why isn't he talking? Why he not answering me? Is something wrong with him? And so that I can explain it to the child. We have had cases of children being mean. That's as it goes, but he also has a big brother. So
that helps.
It does help. But, he loves, but like Dr. Saunders said, he's not interested in playing with the kid. He wants to play next to the kid. So you sit next to me, you do what you're doing, and I'm going to sit next to you, and I will be on my iPad, or I will play with this thing that I'm playing. But I just want he wants, like I said, he's sensory seeking. He wants to be around people. He does have sensitivity in terms of hair cutting was a big problem. And I don't know, Dr. Saunders, if you see that a lot, but cutting the boys' hair, and especially, Black children, and they, that's a buzz cutter. You can't scissor cut it. And that was something we had to build up. But for him, because we actually had his OT come in to look at it, because we're like, what do we do? He's screaming. And she said, for him, the sound and feel of the buzz cutter is painful. And this is the same child, Dr. Jackson, that would fall in the yard and almost break something. Not squirm, not cry, not scream out. But put a blender on and not tell him that the blender is going on. He's out of here. So, you get to know your child, right?
Dr. Saunders, can these children be very violent or aggressive or?
Okay, so I would say this. You can have kids that have significant tantrums, and it can become aggressive. And one of the reasons is because of lack of communication. So they may be frustrated, they may be hungry, they may need to be changed, and they're not able to verbalize. And so they express themselves with tantrums. So I have, experience with some parents where the child will just run full force into their parent, or bite or hit, and or have a tantrum. I've had kids who jumped off the table on their heads, and that's just what they're accustomed to as a part of a tantrum. And so that's where behavioral modification and applied behavioral therapy is an important part of regulating these children's behaviors. And so in the general public's eye, this child goes out, say, with a parent to the mall. For whatever reason, the child has a tantrum, and we as a society, we're not sensitized to these kids. And you're like, why you don't spank that child? He being rude. But no, it's just that this child is having a tantrum, and spanking won't help. And so, I would not say that they are violent, but some can have excessive tantrums that can become aggressive. Yes.
Now, are they still treating a lot of children with medicines? What's the difference between, say, attention deficit and autism? Please explain that to the audience.
So that's a good question.
Yeah.
All right, so attention deficit hyperactive disorder is a separate disorder for autism from autism, and that involves hyperactivity or inattention. So these are kids that make careless mistakes, not focus, cannot sit still. So these kids are described as a moving car. So, that's the word parents would say, he can't keep still, so they're in class, they have loud outbursts, they think they're the class clown, and they have poor school performance. The trick with ADHD, it has to be in two settings. And so, meaning it either has to be in a school setting and at a home, or in a home setting and somewhere else. So that's ADHD. However, interestingly, you do have autism. It comes with other comorbid illnesses. So, meaning that you may not just have a kid that has clear cut autism, you may have a kid that has autism and ADHD. All right. And so, in those instances, the use of medication may have to be considered. So, autism, there's no medication you can use for it. So,
Right.
the management of autism is just basically therapy. But if you have a kid that has a combined disorder such as ADHD, then you have to start thinking of things like Ritalin, Concerta, to
Mm-hmm.
try and calm the behaviors, calm the hyperactivity. And in some
Right.
kids, if they are really aggressive, sometimes these kids may need antipsychotic. But these are kids that are doing self-harm behaviors. So these are
Mm-hmm.
kids that are biting themselves, cutting themselves,
Right.
and that's really at the severe end. And so
Mm-hmm.
those are the kids that you would consider. But the message that we have to get across to parents is that there's no medicine to fix autism.
Mm-hmm.
There is no fixed pill. There are a lot of fads out there. I have some parents that are on vitamin regimens. We have some persons who do stem cell, but none of that can fix a child with autism. You just really have to kind of do
And
therapy and work through it.
is it a genetic disorder? Does it run in families, or it can just show up with no genetic disposition?
So that's a good question. So studies have shown that there is a genetic linked to autism, but not all kids. You have some that are just de novo that just happen. So they have indicated that. So, for instance, they've done studies on twins with autism, and if there is autism in a family, there is a 10% chance that there can be another child with autism. In addition, there are studies that show that there's a genetic component with advanced paternal age. And so that's advanced age of fathers. There are
Mm-hmm.
studies that show that they can have an increased risk of having children with autism. So that shows some link to genetics. And they have done studies that show that there is some link, but I would say that 90% of the cases are just de novo. It just happens.
Mm-hmm.
We're not sure exactly why.
Just a change in the
Yeah.
genetic DNA,
Yeah, just
it just
something. Yeah, so
occurs.
Yeah.
just some
It's just
change
something
in
different.
mutation. Hmm.
But Dr. Saunders,
Paula,
as you mentioned, yes, yes. I
continue,
was
then
just
I'll
going
ask you
to I
something
was
else.
just going to
Yeah.
piggyback off something you said about there's no vitamin, there's nothing, and one of that in terms of behaviors, and
Hmm.
also what the pandemic did. What the pandemic did for us was
Hmm.
we realized Obasi's food sensitivities,
Well, I was just going to get to that question and ask
and
you, Paula, as a
Hmm.
yeah,
parent,
so
how
so for
important is
us,
diet?
Hmm.
it has, over the last year and a half, it has changed our life, because we realized if he ate bready stuff or cookies, bread, anything, pasta, anything wheat based, his hyperactivity, because I remember telling Dr. Saunders, I think this child has ADHD, he can't stop.
And
But the
also,
thing
you have to
is,
consider you naming stuff that's high in glucose,
So.
yes,
Mhm.
pasta, cookies.
yeah.
Yeah, so
Yeah,
that
so
combination.
what we did, because he really can present quite hyperactive. But here's the key: it's not all the time. It used to just be like, why is he like that today? Why, whatever. So we took him off gluten. Not 100%, because we live in a Caribbean situation. You're gonna have to have some bread at some point in your life. But what we did is that we limit now his glucose to just breakfast. So he can have toast with breakfast. And the change in his behavior, just because for him, he has always had a sensitive stomach. There's a lot of things that he doesn't sit well with him when he's eating. And he also was a picky eater.
Mhm.
So we removed cookies completely. So we removed pasta completely. He just has like toast in the morning. And for us, we would not have noticed the reaction based on what he was eating if the pandemic had not occurred. Because we were getting close to the point that he's getting older and he's getting bigger. And if he is so hyper, how do we control him and make sure that he is not hurting somebody else or hurting himself? And it has made, I'm not saying that he doesn't get excited. His mother is quite excitable. So, it did make, I just wanted to mention, it did make a difference. And as Dr. Saunders said, people realizing that their children have different just quirks and that kind of thing. It really, the pandemic really was a blessing and a curse all at once.
So diet is definitely an important factor.
I think it's an important factor for everybody, right? If your diet is not rich in the nutrients that your body needs so that you can think clearly and move and keep a healthy weight, it's going to affect us as adults. So can you imagine somebody who has a growing brain? You want to make sure that they're eating the right things. So our household, we eat fairly healthy. We are not going to not have chocolate in the house because chocolate, but we have made adjustments to his diet and it has helped.
Now think about it. Dr. Sanders, Paula has the ability and opportunity to provide certain things, special care, assistance, that sort of thing. What about the average Bahamian family that cannot afford care, cannot afford the foods, cannot afford the assistance? How do we cope? How do you deal with this kinds of situation? And before we even ask that, let's talk about denial first. Denial is a big challenge. And why I say that, because I do pediatric optometry, see lots of kids. And when they come into my office, I see babies sometimes. I'm trained to observe these children because you know certain developmental signs you need to look for. And just how they're moving around in the office, I'm saying to myself, okay. And then when you examine them, at a certain age, they should be able to see letters, numbers, be able to identify. But you notice they're touching there, and yes, you find parents make excuses for, oh, my child is that sort of thing. And you'll ask questions and you're saying, hey, how do we deal with that denial factor as primary care people and healthcare people?
So I would say that denial it's a significant part that plays with a delayed diagnosis in a lot of our kids. A lot of our parents aren't acceptant or don't want to have the belief that something's wrong with their child. And so, you talk to them. And so as a pediatrician, we have to let parents know our concerns, And so despite them saying that, oh, well, his daddy spoke late, yeah, we're in a different genre. All right. And I see it every day. When I see kids that I have concerns with, I say to the parents, I'm concerned. There's something going on. We get AIRS checked. AIRS tests come back normal. Kids still not talking. And so the most I can do is encourage and explain to parents, the earlier that we can diagnose these kids, the earlier we can start intervention. But even with that, I've had kids that I've even sent away for second opinions. And I've had the pediatricians call me from away and they're like, Dr. Saunders, we're in trouble. What I always try to tell parents that are in denial, this is the main take home for me. We don't have to accept the diagnosis. Let's not accept the diagnosis, but let's accept the fact that your child needs help. Okay, and so we don't have to label anybody. We don't have to use that tag, but I need for you to come in an agreement with me that the child needs help, the child needs therapy, and let's just get work started. You don't have to accept what the title says. Just know that this child has a delay, and the quicker we can move forward, the quicker it can, we can get help. Even with that, I would say to you, we've lost a lot of patients in our office because you tell them that and they're not happy, and so they move on
Yeah.
to somebody who will soothe their I guess their feelings. But
Mm-hmm.
it catches up in the long run because these kids fall through the crack, and then when it's time to go to school, this kid is not performing. The school then has problems. I've had kids who went to school on the first day and was put out of school and said, no, your child needs an evaluation, and they're like, at that point, we're kind of past the door. It's never too late to diagnose, but you have denial is a serious and a significant part of our society. As I
Mm-hmm.
said, people keep these kids locked up in the house. They
Yeah.
don't take them outside to socialize. They don't go to church, because they're embarrassed
Mm-hmm.
to say that they have a child with a special need. And so it's a revolving circle. And I think our society has caused it because our society is not sensitized to accepting these kids. And so parents, because of the embarrassment, they don't seek out. And I see it every week, every other month. We have a child, and the pediatrician would say to the parent, this child needs to be evaluated, and they put it off, 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 and they continue to put it off. But the only thing we can do is encourage.
And
Yeah.
they know when they see certain things. I've
Mm-hmm.
been insulted many times
Hmm.
because when they come in for a vision exam, in a lot of cases, you find that they don't really need glasses per se. As you
Hmm.
were saying with auditory
Hmm.
is fine. One second. Auditory is fine when I check the vision is fine. And then I have to have this difficult conversation with
Hmm.
the
Conversation.
parent,
Hmm.
And for a lot of them, it's hard to accept.
Hmm.
Um, Three examples that stand out to me. When I was in the government clinic doing pediatrics at South Beach Clinic, we used to see lots of them coming in.
Hmm.
And as I mentioned to you earlier, I remember this lady came in with her son to be, he was referred in to have his vision checked because, of course, he was being evaluated at that point.
Hmm.
And she said to me, her child was in a government school with 33, 34 kids in the classroom. And what had happened was, when it was break time, the child went out to break and he never came back to the class. And nobody realized that he was
That he was
missing.
gone.
Okay, let me just stop this foolishness that keeps coming up. And so what happened was, give me one second.
Sure.
All of a sudden, somebody's trying to maybe hack into my computer. I don't know. But
Wow.
what happened was he, one second. Yeah, he was missing until 3 o'clock when she went to pick him up. The homeroom teacher did not miss him, and she didn't know where he was.
Wow.
And so when they went looking, they found him in the corner of the playing field, playing by himself for the entire time. So I said to the parent, well, what did you do? So she said, at that point was when she realized she needed to move him. I said, yes, you can't allow. And she realized that he had a problem, but she was in denial for such a long time that she finally agreed, well, she needed to do something. And therefore, she took him out and she brought him in. So I said, no, he needs to be evaluated properly, but you need to remove him from the school, because if they don't recognize him in a class of 33, can you imagine what's going to happen, as time goes on? And the second incident was a lady came in with her son, and you could tell something was wrong. I had the conversation with the parent, and she was like, no, doc, the same thing. His daddy, blah, 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 and that kind of thing. And I said, yeah, but I said, please have him evaluated because I suspect something is wrong. And she refused. She came back in about 3 or 4 years later. By then she said, doc, I'm tired. She said, I can't take any more of it. I realized that my child has a problem, and she was willing to accept and move forward.
Yeah.
Mm-hmm.
And interesting enough, the other day, it was a young lady, little girl. She's about 7. Brilliant young lady. If you have a conversation with her, you would think this child is an adult. Okay. And you
Mm-hmm.
know what was interesting? She needed some glasses. When I put the glasses on her and I asked her to tell me what have you noticed? She said, "Wow, the floor is texturized." Okay, a 6.5-year-old. I mean,
Mm-hmm.
adults don't even use the word texturized. But
Mm-hmm.
so her mom decided to stay behind because she and I had a conversation. I think she wanted to talk about it, but you know, she herself she just didn't know how to accept. But
Mm-hmm.
she said, so in conversating, she said, "You remember the movie Rain Man? I don't know if you guys ever seen Rain Man
Mm.
with
Yeah, I've
yeah."
seen it. Hmm.
And she said, "You know, sometimes I think my child is like Rain Man because some of the things she would say, her
Mm-hmm.
discernment." And I said, "Yeah." And I
Mm-hmm.
was really a gifted
Mm-hmm.
individual. You know, I said, "You
Mm-hmm.
saw how he used his talent in the movie."
Mm-hmm.
I said, "But it's up to you to decide how you're going to manage that." I said, "Fortunately, she's not one who she's the issue she was having is this child is not going to interact with a 7-year-old because they think she's too womanish. Parents would see and they, oh no, this child is too womanish or whatever."
Mm-hmm.
And then the way she dresses her also, but that's how this child wants to be dressed. So she's not going to be interactive at a party with the kids or whatever. She will
Mm-hmm.
spend time talking with the adults. So I said, no, I said, you just have to learn how to manage her in
Mm-hmm.
her settings and
Mm-hmm.
know when
Hmm.
to say, enough is enough or whatever have you. I said, but yeah, unfortunately, society will see her as, oh, she's womanish and you're doing this.
Mm-hmm.
But, you know, so we have to encourage parents. Yes, if you see something is wrong, how do you get help? Help is the biggest issue in all of
Mm-hmm.
this because at the end of the day, Paula, what is your goal for Obasi? To ensure that Obasi can survive in this environment as he ages. Because if something would
Mm-hmm.
happen to you or your husband or your son, Obasi needs to be able to continue on in his life. So, you know, how, as a parent, what are your goals for Obasi long term? Can't hear you.
I hear you.
Let me add your other stream. Can we hear you in this stream?
Hello?
No, we can't hear you. Let me just ask Dr. Sanders while we try to get Paula back in. You know, we're having
Mm-hmm.
technical glitch, but it's all a part of it. Still can't hear you, Paula. Um, what do you say to parents in
Mm-hmm.
terms of your child? What you know, long term goals?
Yeah, so it depends on the severity of what's happening with the child. But if if I see a child that is delayed, I try to encourage them in terms of vocational skills, making sure that they are trained in terms of being able to do something with their hands. Not all children may be academic. Some kids may be technical, so they may be able to fix a computer or work on a car, work in a farm. And so we still try to encourage parents to at least get some type of vocational skill on board if that child is functionable enough to be able to do that. And so that parents know that this is not a dead end, not because my child is not performing well in school means that that's the end of the world. And so we definitely just have to encourage them in that aspect. When you talked about that little 7-year-old girl, it reminds me of another kid. So kids with autism have something called hyperlexia. And hyperlexia is where they have this advanced ability to read and identify at very early ages. So from the age of 2 to 3, you have kids who can pick up a book and read. And a lot of
Mm-hmm.
parents look at that as gifted and,
Mm-hmm.
remarkable,
Mm-hmm.
but it's a red flag. So when we see that, that is a sign or symptom that this child may have challenges. So as a pediatrician, my role is just to encourage parents to ensure that they look out for the best for their children, ensuring that they have all of the skills needed to function as adults.
Right. Now, you
Can
you
you?
brought up a good point there about, yeah, child being able to read at 2, 3, and parents think
Hmm.
that they're gifted. You
Hmm.
know, how do you break that news to them that this, yeah, it's a gifting in one sense, but it's
It,
a
it, it, it,
problem.
it's a hard you. It's hard. I had a kid that came into the office. I actually had three kids. One that came into the office, he was 2.5 at the time, and he opened up the window. He looked outside at the license plates, and he started to call off the license plates, and then he started to call off the make and model of every car in the parking lot at
Wow.
2.5 to 3. And the mommy was excited. She said, "Oh my gosh, isn't he brilliant?" And I said, "I am scared." She got offended. She got
Yeah.
offended and she was like, "What do you mean by that? He's gifted." And I was like, "That is hyperlexia. We really gonna have to watch him closely." And I'm like, "Tell me about his friends." And he didn't play with kids his age. He would only play with his older cousin who was 9 or 10. He was fascinated with trains. Um, he had these abnormal fascinations. He, at the age of 2.5 to 3, he could identify polygons and hexagons and octagons and
Wow.
all of these abnormal shapes. And she was elated, and I was fearful because all of these were red flags for me that this child, and interestingly, when I said it to her, apparently she had a cousin who was a psychologist in the U.S. And she said, "Oh, my cousin told me that yes, I need him evaluated because he may be gifted." But I think the cousin um probably didn't know how to say to her that
Tell her.
I think he has a concern other than gifting. And I lost that one, unfortunately, because she got offended, and she pulled her son because of the concerns I had. And it would be interesting to see because he should probably be about maybe 7 or 8 now, to see, where he's at. I'm sure he's doing well in school, but the challenges for that child definitely would be the social, and to
Right.
see, long term where it results. So it's a hard diagnosis to tell parents because thinking that your child is gifted. I'll say this: for all of the kids that have had hyperlaxia that I've come across, they also had significant social behaviors. So these were the kids like with the significant tantrums. So even though on one end they were gifted that they could read, but on the other end, sorry, they were doing abnormal stuff. So like the
Right.
kid who could read, he was going in his pampers and taking feces out and smearing it on the wall and tasting it. That's not a normal behavior for a gifted
Right.
child, and so even though a child may have that special ability, you have to take the whole picture into context and look at the whole child in terms of all of the behavior, not just the
Just
fascinating thing that they could read.
can you all hear
Interesting,
me
very
now?
interesting. Yes, we
Yes, we
can.
can.
Welcome back, Lady
Woohoo!
Paula.
Listen, I had to
Now,
go all the way out and come back. You asked an interesting question. And I just wanted to touch on it because you were
yeah, I
asking
want you
Hmm.
to tell
what is my
what are your
vision?
long-term goals for
Hmm.
Right.
Obasi as a parent?
My long-term goal for Obasi is that he can live as independently as possible, find something that he can do in terms of a vocation that will bring him satisfaction and also give him a little income. But I appreciate
Hmm.
that given his challenges, he is probably going to need an assisted living situation. And so part of what his father and I are working on is trying to figure out how to put things in trust, how to set up a sort of almost like an annuity that is going to help manage his ongoing upkeep as he moves past adulthood. Because one of the things, like I have quite a few friends that I went to school with who also have kids on the spectrum, and a lot of what we talk about when we come together, how are we outliving these kids? Because we know they're going to need long-term care, and it's not something that a lot of parents with neurotypical children have to think about. You don't have to think about outliving your kid. You don't have to think about who is going to take care of him when I can't take care of myself. But as a child, when you have a child with something like autism and on the spectrum at the point where Obasi is, it is a serious concern that you need to put things in place so that he can function when you are no longer there. And it's a hard reality that a lot of us parents face, you know.
Now, I guess the reality of marriage or relationship, that's don't want to say it's not an option, but it's limited, isn't it?
Yes. I don't expect that he is going to be in a long-term relationship or get married. That's not a goal for
That's
him.
not
It
a
would be
goal.
lovely. It would be lovely, but I don't believe that it's a goal for him. My goals are he needs to be as independent as possible and find something to do, because I know his personality is that he's not going to be content just being taken care of for the rest of his life. Even now, he tries to be independent. And so have something to do. It may not be, he is not going to be the next Surgeon General, but he can find something that he can do well that can add value to his life and add value to the community wherever he decides to live. And I just want to say, this is not a problem that is unique to the Bahamas, because I have friends who don't live in the Caribbean anymore. They live in, first world countries, and all of us are in the same boat. How do we protect these children when they become adults? Because what a lot of people think is autism is something you outgrow. No. If a child with autism becomes an adult with autism, becomes an old person with autism. And so what happens is that people think when he's 20, well, it'll be okay. But no, we need to make plans for him for when he's 40 and when he's 60, that something is in place to follow to make sure that he's on the right track. And it's kind of hard, because even as parents, we don't like to write wills. We ain't writing no will to leave nothing for nobody right now. And you have to think about that in the case of your untimely demise when you have neurotypical children. So can you imagine when you have children? Basi's functionally nonverbal, and he does use his iPad to communicate because he has tap to talk technology.
Caller's gone again.
Yeah.
Dr. Sanders.
Yeah.
Y'all first for a while, yeah.
Okay.
So I'm
Dr.
saying that he has
Sanders.
tells.
He has what?
That only his family. He has tells.
She's freezing again.
Yeah. Not sure what's happening with her system.
Dr. Sanders.
It's
Go ahead.
so yeah.
Paula and her family are able to provide for Basi. Let's get back to this question. We think of the families who don't have it economically, don't have it financially. They can't have their child or put their children or child on a special diet. They may not be able to come for the care, go to a particular school to get that help. What encouragement, what do you say to families or individuals out there like that who would have a child and resources are limited? How do they get help?
It's a challenge. It is a significant challenge, and even with people with resources, because the therapy and the interventions are expensive. Behavioral therapy, speech therapy, occupational therapy, none of this is really kind of provided in our government system. And so for parents, that's either out of pocket, and even with parents who have insurances only cover a certain amount. And so it's hard. It's hard. It's a struggle with parents trying to meet ends, not being able to put their kids where they want to be in terms of special schooling. It's a challenge. But for the most part, with our parents, we encourage them that there's still hope. We ask them to, and so that's where organizations like Reach step in, because Reach is an NGO, and so Reach offers food assistance, not just food assistance. We would have had a summer program where we'd be able to offer some of these same interventions for free. So in terms of the therapies, just so that parents can get exposed. So this is what, my child should be getting. But it's hard, it's hard with parents who just trying to struggle to put food on the table, and just trying to make ends meet, trying to keep the light on, trying to make sure the rent is paid. In addition, having to deal with a special child, it's rough. And so you can imagine with COVID, with these parents being locked up in the house with a child that
Mm-hmm.
has uncontrollable tantrums, a child that's hungry, and going back to the GI issue with kids, if their diet isn't adequate, they can have constipation, they can have diarrhea, they can have food insensitivities. And so, the circle just revolves. And so it is a challenge. It's a sad situation. But despite that, you still have to encourage persons that, there's hope, there's a better light around the corner. And we just have to keep pushing to ensure that every child has a chance.
Paula, we want to
Yes.
transition now. Good time.
Okay.
Who is Reach Bahamas?
Reach is an parent-led organization that's been around, like I said, from 1999. But more importantly, Reach is a good community for anybody who has a child on the spectrum or a young adult on the spectrum to come together, to get ideas, to be able to fellowship. Because a lot of people, when you talk to your friends and family, they can't help you. But if you talk to somebody who has been through it, that could give you assistance. Reach, all of our programs are free. And as Deshaun mentioned, we have that summer camp that we can't wait to restart because it has made such an impact on people's lives. But we also have parent support group meetings where we come together to talk about things that are important to us in the community. And that's every fourth Wednesday of the month. We still have them virtually. So if you check our Facebook page, you'll be able to see when the next one is. It's on the 23rd. This time around, we'll have an OT talking about behavioral issues during the pandemic. But also, it's good. It's good to fellowship, but also we do have training sessions where we help our parents get the rudimentary skills in order to be your child's first therapist. Because if you think about it, you are with your child more than anybody else. And if you cannot afford a therapy, you can start small. You can teach basic skills. You can probably help in behavioral adjustment, a little speech therapy, a little, and every little bit counts. And for me, I can say that talking to people who are trotting the same road that I am trotting, they may be ahead of me, behind me, at the side of me, it is so freeing. It really just is supportive, and a supportive environment that you can feel free to share ideas. It's connection is everything. And especially now with the pandemic, we can see that connection is everything. So I would suggest you find Reach, you talk to somebody who can help you.
How do they find Reach?
Reach has an office that is on the QC campus. It's in the Global Village building. So, and the number is, remind me, Deshaun, 328.
281. I think it's 328-1425, but let me just confirm
4125, I believe.
Yeah.
And it's also the email address is reachbahamas@yahoo.com. Am I right? I haven't had to call these numbers.
No, Reach Autism Bahamas at yahoo.com. Yes, that's our
say it
email.
again. Reach Autism Bahamas at yahoo.com. And the number is what again?
32. Go ahead.
Right. Go ahead.
Number 328.
1425 or our cell number.
1425, and the cell number is
477-6016, and that's our office cell number. We have a WhatsApp group attached to that number, and so feel free to call in. We have an awesome office administrator, Aisha Watkins,
our everything lady.
She's our everything, and she's able to take that call to give more information. So it's 328-4123. All right.
328-4123. 328-4123. Now, before the pandemic, what sort of things did Reach do in the community? Paula?
We had every year our summer camp. The last 2 years that we had it was therapeutic intensive summer camp for 4 weeks. The children were getting snacks and meals, art, swim, music. They were getting OT, ABA, speech therapists, all
What
for
is
free
OT? So the audience would know.
occupational therapy. I'm sorry,
Okay.
occupational therapy, applied behavioral analysis therapy, a little bit of speech therapy that we offered for free. We also have every year an Easter egg hunt for our kids. We have a Christmas party and monthly parent support meetings, and every so often we have speakers come in to talk, but we also have training sessions, which is where I first learned how to deal with Obasi and picture exchange technology and that kind of thing to help him communicate. But you know, one of the strongest things about Reach is our community. So if you can join in and get onto that WhatsApp group, sometimes the conversations are very helpful for people who are struggling. Sometimes people are talking about things that don't necessarily interest you, but certainly there will be somebody, if you put a question in, who would have an answer, who can help. So that's what we did. We continue with our virtual stuff, and we're really hoping that during this summer we can offer a couple activities, socially distanced, of course, that our kids can participate in, just to give them an outlet to be themselves and to be free. So
now, Dr. Sanders, in the past, here in the Bahamas, a lot of special needs children were just categorized as retarded. Okay? They were all lumped in that one category. The child is retarded. And so most of these children went to Stapleton School. That was the outlet that was provided for them before they started having special schools at Garventines. I think it's the first autism
Garventines
school, and
does
then
have an autism unit, yes.
the senior high school out south.
Anatole Rogers.
Anatole, right.
Rogers.
However, explain to our audience, please, this word retarded as opposed to being autistic or having Down syndrome, that sort of thing.
Okay, so for starters, the word mental retardation no longer exists. So I'll
Okay,
start with
please
that.
clear that, yes, because
Okay, it's called intellectual impairment.
it has a nice sophisticated word,
Yes,
intellectual impairment.
Correct.
Okay.
So that's the first thing. So that word no longer exists in our language. Okay. In the past, everybody was placed into that basket because there was not a definitive diagnosis. There was not definitive signs and symptoms that a child showed. And so once a child was deemed as slow, they were thrown into that basket. But as time went on in terms of education and training, you were actually able to delineate a certain subset of children who did not have significant or severe cognitive impairment. And you notice that these kids had some functioning, and not only had some functioning, you noted that there were only certain areas that were affected. And that would have been the social, the communication, along with the repetitiveness. And so when you saw that being established, this subset was able to be pulled out off the basket of intellectual impairment and into the basket of autism. Okay, and so as a result, it allowed more programs to be developed, so more schools to also take on these kids. And so in addition, so it's not just Garventines, it's not just Anatole Rogers. Bullet Patton has a unit, Palmdale Primary School has a unit, and so there's also a preschool on East Street South that has a unit, and that takes in kids that are not ready for Willard Patton. So these are the kids that are likely not potty trained, kids are who are a lot younger, and so, and even primary preschools privately, they have also taken on that mantra where they're able to deal with this subset of children to ensure that they get the adequate exposure, the education, and also bringing in intervention into their programs. And so the word mental retardation, as I said, is no longer lingo, it's intellectual impairment. And the subclass of autism has actually been pulled from that because, you know, these children present differently.
Okay, so it seems as though we have really developed and moved quite a ways in our society in terms of help and training, because with all the different programs coming on stream, obviously there are more persons who are trained in the area and who are able to help. How big is training? I don't want to say training, but how, Paula, maybe you could answer this in terms of persons becoming involved in education to work with special needs children. Are we seeing an increase of that, or it's still a challenge?
Okay. What happens, and if I could plain talk bad manners, what happens is a lot of people do go into the field of technology. I'm sorry, of therapy. Our young people don't come back. They find jobs abroad, and they're not. So what happens? We have a bit of a brain drain when it comes to people who go into these therapeutic fields. And so that's why it's so hard to access some of the care that is required, some of the therapies that are required. One of the things that we were looking forward to, and we're hoping that UB does take up the mantle of starting to have a special needs area on campus that will train Bahamians to work in the field. It was something that was picked up recently. I'm not sure where it is now, but it's really important for us to maybe train our people here so that they stay here to help, and there are people who take it upon themselves to go and will come back, but more often than not, even scholarship children young people, they don't come back.
Well, think about it, those special needs, you're offered more because it's special needs, right? And in a bigger society, if you can find someone or lure somebody into that field or to come and work for you. I mean, here in the Bahamas, we can't even come close in terms of paying salaries to compare with a big city or elsewhere. But
the need is so great, though. The need is so great that even when young people come back, within, Deshaun, what would you say? Within 3 months, they are overwhelmed and they're bombarded.
Yeah.
The practice becomes full, and the waiting list becomes long. So I think it's a very lucrative business to be in, profession to be in, because you'll be helping people as well. But our children, according to Autism Speaks and these organizations, when they call the kinds of hours of therapeutic when we talk about intensive therapeutic care that you can give a toddler to a primary school child in order to get them to advance and to get them to reach to their highest potential, they're talking 20 hours a week. Do you know what 20 hours a week would cost someone? I mean, even people with means can barely afford half-hour a week. Right?
Yeah. We don't like to pay taxes here in the Bahamas. However, in order to see these institutions and programs develop, eventually someone will have to fit the bill in order for the government to provide the facilities, isn't it? And as time goes on, as societies evolve, you're going to see taxes being implemented for special needs children, for special needs program. We think of hospice care. We think of our
assisted
elderly
living.
Yes, all of these different things. There is a cost involved, and for training and anything that requires special needs, finances is definitely a major factor.
Definitely.
Ladies,
and just yes, I was going to give you an idea of what cost is, but it's really just heartbreaking.
No, you can say it.
Usually, you can pay anywhere from $75 a half hour to $150 a half hour for therapy,
depending on who the person is.
Depending on who and where and when. Yeah.
So, somebody said the insurance agencies only want to give 10. So with that, said insurance agencies only want to pay for, I guess, 10 sessions per year.
Yeah.
And a kid could need 5 sessions a week.
Right.
And that could be finished in a week.
Parents would have to learn what to do then in order to.
Yeah. And
themselves.
the thing is, there's so much. There's a volume of information that's available now. You
Online,
know, with the internet
online,
and
yeah,
online. And
Hmm.
online. There's a lot.
if you are so minded to work on it and to get information, you can find it to help yourself. But it is a hard process, even for somebody like for me. I have a project management and IT background, but there is also that it's your child, and it takes a certain gumption and a push and dedication to say, I am
Hmm.
going to stream through these vast fields of information and
Hmm.
find what works. And because the first thing you try may not work, the second thing you may try may not work, and you just have to keep going until you find what works and
Yeah.
implement it. And it's a process
Hmm.
that does not stop. So
Um,
as parents, we need breaks too. But
yeah, yeah. If you're there all the time and you're having to train and teach and whatever, it can take its toll on that person
yes,
and that individual and on families in particular, because yes, you
yeah,
do need a break. And when you go on vacation or if you take a break, this person has to be with you also, or you need to be able to find the funding for some trained person to be there while you're absent. So
Hmm.
a lot
and
is
to be able to
required.
handle your special needs child.
Each
I mean,
child,
for
yeah.
me, my child does not speak, so my thing is I have to have faith in whoever is taking care of him in my absence, because he can't report to me that something has happened.
Dr.
So
Sanders, as
Hmm.
we begin to wrap up, what do you say to teachers in particular who start to see these children at an early age and suspect something may be wrong? What advice would you give to them?
Right. So the advice I would give to teachers is to make the parents aware of their concerns, because I always ask parents, what did the teacher say? What did the school say? And a lot of times teachers see that these children have concerns, but however, they are afraid to address the issue to the parent. But I think as teachers, they need to be honest with the parents, because, as I said, when you look at ADHD, it's in two settings. Autism is almost the same thing, because some parents may not realize it. But the teacher may say to them, and that I had that happen with one of my kids. The first day the kid went to school, the school sent the kid back home. They said, no, this kid needs evaluation. He was 3 and not saying a word. And the parents had no concern, because as far as they were concerned, the daddy had started to speak late. And so, as that was not an issue for them. And not until the kid was evaluated, they realized that, oh my gosh, all of these things that we taught was just cute or maybe peculiar was actually a part of a diagnosis. And so I would encourage teachers not only to tell parents, but also be educated themselves. So you do not have to be a special education teacher to be aware what the developmental milestones of the children in your setting should be. And if you see a child that you notice that may not be interacting, that's not talking, that's not playing with other children, that's having tantrums in the class, that's smelling their food or tasting the food, doing peculiar things that a normal child of that age should not be doing, then you as the teacher, I think you have the onus to also let the parents know of of your concerns, so that it can be addressed. Because the
correct.
denial element is hard for parents, but when they realize that other persons are also seeing,
Seeing it.
yeah, then that kind of drives home to a parent that, hey, maybe there is something wrong. And not to just listen to the naysayers or the family members
Right.
who say that, no, there's nothing wrong. Auntie Sue talked until she was 5 and realized that, hey, there is truly something wrong with my child, because this teacher sees other kids. So it's not just
Right.
your one child, they are around other children, and they're realizing that, hey, your child does have some special need that needs to be addressed.
And even
Paula,
though it's a difficult conversation for a teacher to have, one of the things that because I had conversations with teachers, not of my own children, but friends who are teachers, and say, well, I don't know why they don't just diagnose these children. And I say, and then what?
Hmm.
Does that
Correct.
mean that automatically that child is no longer in your classroom?
Hmm. Hmm.
No, a
Hmm.
diagnosis does not a solution make.
Nope. Hmm.
what do you say,
So
Paula?
there's a sense I say yes, you should diagnose, because for me, I like to know what I'm dealing with, right?
Mm-hmm.
But also be sensitive to the fact that in some places and in some, based on the pocket or the situation that family might be in, the child is going to remain in your class. And so it's, maybe push the parents to try to find something that they can do themselves to help with the child.
Now,
It's a rough road though, and there's a lot of judgment. And as a parent, we get it
but that's what I
from
want to ask you.
insensitive people as
Yes,
well,
that's
because
exactly. Stop.
people
Hold it right
feel.
there. Hold it there a second.
Hold
What
a
do you
minute.
say to the general audience in terms of sensitivity? You want to take your child out somewhere, and the child may not sit still, or the child may be quite busy,
Yeah,
and people are looking. What do you say to the
I
general
usually
audience?
tell people, if I often am educating people about autism, but also one of the things that is always part of my spiel is, regardless to what you believe, be kind. Just be kind, because there are ways to do things. You want to tell me to
Mm-hmm.
slap my child because he's having a reaction to his environment, as opposed to offering assistance. How can I help you? I see he's having a hard
Mm-hmm.
time. How can I help? There is a way to do things. You can be concerned and kind. You don't
Mm-hmm.
have to be mean. I've been told all kinds of things, that it's a generational curse,
Wow.
that we don't pray enough, that we don't discipline enough. It's because you're too lax as a parent. Keep him home. But the same child that will give a tantrum in a supermarket, if he's going every week, you get acclimatized to it. That's all ABA is: training children how to
Mm-hmm.
behave appropriately in different situations. And we can't train them if they are not seen, not being
Mm-hmm.
interacting. So two things: ask me a question, offer help, and be kind.
What
That
about, have you ever been turned away from somewhere? You can't come to
Yes,
this event because.
yes.
So how,
I have
what do
been
you
I've
say
been
to that?
asked, if you don't want my child, then it's it's fine. You don't get any of us. I've been turned away from church
Oh, wow.
for him making inappropriate noises, because he loves music. And when there's singing, and then when there's silence, he'll continue. And I appreciate that some people are there to get into a calmness, but he is not trying to disrupt. But if I spend my whole, why don't you just take him outside? I'm coming to church as well for my own solace, and I will get none of it if I'm outside of the church, because so yes, I've been turned away, and it usually, it's just ignorance of just different situations, and
Yeah.
education goes a long way, awareness goes a long way. And then sometimes, we as parents and as families and our community, we just support our children. Because also, what people do that annoy me, and I'm just speaking to the general public: don't speak about my child in front of my child. He can hear, he does not speak, he understands what you're saying, and he's embarrassed too. Nobody likes to be pointed at and spoken badly about. I may answer on his behalf at times, but you can address him. How are you today, Obasi? A smile might tell you a lot, or a frown, but just ignoring him completely is not helping anybody. It's not helping us as a family, and it's not helping him, and it won't help you either.
And the bottom
So,
line is, we as a people, and people in general, and that's why I do this show, for education, because when we begin to educate people, all aspects of society, there's no perfect world. We all have
no.
our challenges, but at least if we learn to show respect, learn to be kind, learn to be sensitive, and then learn more about the individual or about the condition, then we will respond better as a society.
Definitely.
This world is made up of so many different mixtures, so many different individuals, and we all have to learn as one body to be able to accept each other and to try and work along with each other. And so, that take home, Paula, in terms of that. And yes, it probably will continue where people will deny you the opportunity to participate in certain things with your children because of your child. But at least the way they do it won't be as offended as opposed to coming off in such a negative monotone. So we're hoping that you're listening.
If they just remember to be kind, maybe ask a question, offer help. Those are the three takeaways,
Question, Dr. Sanders, very important one. Someone asked, what are your thoughts regarding childhood vaccinations being the cause of autism? We on to another big vaccine, and I mean, come on now, so help us out, please. Help us out.
So I see the question in the chat. There is no link that has been shown for vaccines causing autism. I will say this: in the past, they looked at the MMR vaccine, which was the measles, mumps, rubella vaccine, and the thought process is that there was something called thimerosal, which was an ingredient that was made to preserve the vaccines. They tried to make a link with that causing autism, and that has been debunked. And so there is no scientific evidence that shows there's no correlation. I'll say this to you. I've had a parent in our office who actually had a child with autism, and they were convinced it was the vaccines that caused their child to have autism. And so they did not vaccinate their younger daughter, and she has autism also. And so that in itself proves the point that there is no link with vaccines. You have some countries that don't give vaccines. You have some areas where the vaccines are not accessible. And despite that, you have autism. I was in a research program last month, and this is a worldwide thing. It's not just unique to the Bahamas. It's not unique to the United States. This is in China. This is in Europe. This is in Turkey, the Philippines.
It's worldwide.
It's worldwide, and there's no correlation. And you have a lot of anti-vaxxers out there who still try to sell the myth. Yes, there was a doctor who a few years ago had tried to do a research, and it was noted that the research was actually fraudulent. He actually lost his license. He went to jail because he tried to use false information to sell a theory. And so there is no link. And so I endorse vaccines. And because of anti-vaxxers, I'll say this to you: we now see diseases that we haven't seen in 50 years. Last year we had 3 kids with measles. Like measles, I read that in a textbook. Like I don't expect to have to treat a kid with measles. We've not seen that for 50 years, but because of now the reduction in vaccines, these diseases that were all thought to be eradicated are coming back slowly, and that's because of herd immunity now decreasing, and so you're now allowing these things to come back in, and so everything is a catch-22, and so people are blaming it on vaccines, and I can say evidently there's no evidence to support it. There have been actually over 70 papers over the last 10 to 15 years that have looked into this evidence of vaccines being a cause for autism, and not one of the papers found any evidence to prove. So no, I do not support that theory.
Good. That's a good wrap up of that, because that's a highly controversial theory.
It is.
And a lot of people still suspect and believe that it contributes, but there is no documentation to prove it at this point. So for those who are listening, please, vaccinations are important. And we challenge now in terms of another vaccination. So, you have to really think about it individually and make wise choices.
Definitely.
Our healthcare individual sent a note saying that she's from South Florida, and she said that she's willing. She has a grandson who has autism, but she would be happy to assist with development of strategic alliances with South Florida organizations. And so she sent her number, and I'll give that to you guys at the end. But Hey, any sort of interaction with other groups to be able to get help and assistance is always needed. So thank you for that information. And
Thank
I
you.
think the last question we'll have, it says, if a parent suspects that the child has autism, where can they go to get diagnosis? Says, I know, Dr. Sanders, you're one of the doctors, but most parents don't have the funds. Where do they go for help?
Okay, so that's a good question. I would say start with your community clinic, because if you go to your community clinic, you can then get a referral into the hospital system, where you'd be seen by a neurology clinic. Now, because of COVID, our clinics are only on a telemedicine base, so we've not really been doing face-to-face clinics. We had started, and then when the surge came back, we had to place a hold. In addition, the Ministry of Education also does evaluations. However, they don't start evaluations, I think, until the age of 5. So, Ministry of Education is also another portal where you can get your child diagnosed. But if the child is younger, then my recommendation would be to go through your community clinic
Clinic.
where they can get a referral into hospital.
And the other thing also is persons can now sign up for NHI, and be
So they can
assigned
sign up for NHI,
assigned
right?
to a
And so once
particular
again, right.
doctor
And they
and
can be
then
correct.
referred
And
from
then they
there.
can get referred from there. So,
Yeah.
right. So it starts with a referral. So you just can't show up to the hospital and say, I need my child diagnosed. It's a referral process. So I would suggest going to your pediatrician or your general practitioner where you can get a referral into the clinic so we can go from there.
Ladies, this has been a very, very, very good show. Very educational, very deep and profound, and it definitely dispelled a lot of myths among some people. It opened the door for proper communication in terms of dealing with the condition, how to go about trying to accept and get help, because that's the important thing in the long run. Children are being born on a daily basis, and many of these children are going to have developmental challenges. Once the child is diagnosed properly, then proper treatment and referral and treatment could happen. And so we want to say to the general public, and in particular to our Bahamian people, autism is no shame or disgrace.
Mm-hmm.
It's a condition that is like any other disease condition around. And the important thing is to be able to get help for your child, because in the long run, it's you who have to live with this child for the long term, and you are the one who have to find the support and help that is needed. And these children aren't going anywhere unless, they were to succumb. So you're in it for the long haul. So REACH is an organization that you can reach out to, and they can provide help and assistance and kind of redirect you where you need to go. And Dr. Sanders is a wonderful pediatric consultant. She's available to give guidance and to give help and to kind of steer you in the right direction. So to our audience this evening, please, autism is real. It's not going anywhere, and ADH is a part of it. And therefore, you need to pay attention to your child, know what developmental signs are, and don't be in denial thinking, because as time goes on, reality is going to set in. And the earlier you can get help for your child, that's going to help you as a parent and the family in the long run. So we want to thank you, ladies, so much for the information that
Thank
you've
you.
provided today in sharing our story. This is the last session for this first season of Share Your Story, and what to end it on a bang, talking about
Thank you.
autism.
Thank you for having us.
I'm just going to take you off the stream for a second, but don't leave. Just want to say
Okay.
a few words to the audience. To our listening audience, I want to say thank you so much for supporting Share Your Story for this past year. It's been a wonderful time. We've tried to provide information concerning disease, conditions, and things that affect us here in the Bahamas. And so we look forward to resuming in the fall and trying to find other interesting topics that we can provide and discuss. But when it comes to children, we all have either children, grandchildren, nieces, or nephews, and we love them. And so We want to ensure that they get the best help and care provided. So this evening's discussion was definitely the one to end with, because as you go into your summer break, you're going to be interacting with lots of children and others, and you want to be able to provide whatever help you can to them. So thank you to our listening audience for being a part of the show for this past year. Special thanks. I cannot always not forget my husband, who's the one behind doing all the advertising, the posters, and then my son who helps with the technical aspect. And to you all who have made the show a success for this past year, I want to say thank you very much. The show is being brought to you by Palmdale Vision Center. We care for your vision as we would our own. Some people are wondering, why would a vision clinic be bringing on information about other healthcare? But hey, that is what life is all about. The entire body is connected. And so we all need to discuss issues that affect us individually. So once again, thank you for being a part. And we want to say good evening to our audience and see you again in the fall. Thank you very much. Good evening and God bless you all.